Welcome to the Industry Show. I'm your host, Nitin Bajaj, and joining me today is Ameer Mody. Ameer, welcome on the show.
Thank you. Happy to be here.
Pleasure is all ours. So, tell us, who is Ameer?
Um, I am a pediatric emergency physician, second generation Indian American. My dad immigrated here in 1960. Born and raised in Southern California. Uh, Trained in pediatrics and then specialized in emergency medicine. I work at Children's Hospital Los Angeles Emergency Department. I've been there for the last 11 years. I'm the associate division director there. My wife and I live in Orange County, raising three wonderful teenage children. Between those two things, that's basically me. That takes up most of my life.
And on top of that, you live on the edge, working in an emergency department. So, tell us a little more about the Children's Hospital of Los Angeles and the size and scale of its operations and the number of patients you see.
Is a what's called a freestanding children's hospital, meaning that the only patients that we take care of are children and young adults, children, teenagers, and young adults. It is the largest children's hospital in the local area. One of U.S. News and World Report's top five in the whole country. The emergency department is a level 1 trauma center, meaning that we see the sickest of the sick kids. We see the most injured kids that happen in kind of our local area in LA County. We are an emergency department is basically what I like to consider like the community safety net. And so when something goes wrong, when something serious goes wrong, when something major goes wrong, or something small goes wrong, the fact that we are there, that we take anyone who walks through the door. So emergency departments are governed by a mandate that requires them to see anyone who walks in the door, regardless of their ability to pay, regardless of even if the fact that they may not be children. So we have adults that will sometimes wander into our emergency department as well. And so a wonderful thing about the mandate of emergency medicine is that you take care of anyone who walks in through the door to the best of your ability. And so that can be the sickest of the sick, that can be the most injured, or that can be simple little things, or sometimes nothing. We've taken care of, before COVID, about 100,000 patients a year, the last year before COVID, seeing the entire depth and breadth of illness and injury that happen in children in our community.
Wow, that's astounding. And it's amazing and it's great that that kind of mandate exists. I'm sure that brings a lot of challenges with it. So tell us about the biggest challenge you're facing right now.
Yes, it is. It is a wonderful piece, I think, of our society. That role that emergency medicine plays. Again, we will see. So I'll give you a couple of examples. And so because the pandemic, I think did a lot of things to our society. One of the things it did is it kind of revealed some of the cracks, the crevices that have happened or that are happening in our society. So, in the first days of the pandemic, when everything when everything was shutting down, and you remember the lines at Costco and the toilet paper shortage. Well, in those first days, typically during a typical kind of March year, we will see between about 300 and 350 patients a day, because it's the middle of the flu season, and it tends to be our busiest time. We prepared for, we built a tent in the parking lot. We actually built 2 tents in the parking lot to deal with a huge surge of what we thought were going to be COVID patients. And the emergency that we prepared for was not the emergency that we got. What really happened is that our 350 patients a day that we had anticipated to go up to 400 and 500 dropped to about 50 to 75 total. We had a huge drop, and so everything shut down. No one would wander out. The few patients that we did see, a couple of patients that we saw during those first few days were mothers that were looking for formula for their babies. And so, all the stores ran out of everything. And so if you have a baby that relies on formula, and you don't have anywhere to go, we are the place that you go when you don't have anywhere to go. And so we were handing out some cans of formula in the first days of the pandemic. Definitely not the emergency that we prepared for.
Wow, I can't even imagine. And yeah, that's so much. It's so profound. Tell me a little more about, you know, so there are these mothers you are helping, and then of course there is all these cases that are coming out, and there is this knowledge and this fear that's spreading. What was the, the temperature of the room as you speak, right? What were you guys discussing as a team, and what kind of information were you processing at that point, and feelings?
Well, there was so much, and honestly, I think we are still processing some of those
Yeah.
thoughts and feelings that we've had. Um, we again, I think the challenges of the pandemic were really unprecedented, and the rate at which information was coming in, the things that we potentially had to prepare for and not prepare for, was something that I've never experienced in my career before. And so the challenges of PPE, or personal protective equipment, we didn't know exactly how effective our PPE was going to be. We didn't know the supply lines for replenishing our PPE weren't well established, and so we were saving it. And for those of us, I think, who've worked for a long time, and if you've seen your doctor, before last year, when you saw your doctor, their doctors almost never wore a mask, right? And particularly if you are a pediatrician, right, your ability to make children who are terrified, or even just a little frightened or anxious, to set them at ease, to set parents at ease, comes a lot from from the facial expressions that a smile or a laugh are skills that pediatricians have in order to comfort children, in order to get to the right information. And so the way we practice medicine was so profoundly affected by what happened in the pandemic, and we just had to learn, and adapt to what was going on in real time. And I will tell you, so our division, the doctors in our division, there's about 60 of them. We typically we meet about twice a month for about 4 hours with our staff meetings. We do our academic discussions, we do journal club, we do a variety of different things. In the first month of the pandemic, we met twice a day. We had our team meetings twice a day because the information was coming so fast.
Yeah.
The changes in our PPE protocols, the changes in how we were going to test, who we were going to test, what we had to prepare for. I've never been through something like that before, and it has put a certain amount of both stress on I think people who are in the healthcare field, because of that kind of great unknown of what we had to deal with, and stress, but then and then also just realizing how quickly we can adapt. Because the other thing that I know about what we do in healthcare is that we tend to be slow to change, slow to adopt to new things, and when the pressure of the pandemic hit, our ability to quickly adapt and to develop new protocols and new processes was astonishing. So I'm so proud of what we had done with regards to innovation, protecting our staff, and I would say that all things considered, we were pretty successful in handling some of those things.
Well, never let a crisis go waste.
Right.
And I'm sure there must have been a lot of heroes must have come to the fore, right?
Yeah, I think for us in pediatrics or in emergency medicine, we look to pediatric emergency medicine is different than adult emergency medicine for sure. There is the functional word more often is going to be pediatrics as opposed to emergency medicine. So what is different about it is that our patients tend to be not as sick as adult patients. Children are generally healthy, and even when they get sick, they tend to bounce back better. They are more resilient. They're more resilient in so many different amazing ways. The flip side of it is when a child does get sick, the gravity, the anxiety, all those feelings come to the front. So I have many friends who are general emergency physicians who are my heroes, who waded into this pandemic and had very dark and challenging days of clinical care, and doing things just at a hero's pace of seeing so many, this huge glut of sick patients.
Mm-hmm.
For us, it was different. The patients that we saw, a less number, but again, I think the challenge of pediatric emergency medicine is that the weight of it, the gravity of it, the fear that parents have, dealing with the anxiety and fear of parents, pardon me, is a different level. And I know that my friends who are general emergency physicians look at me and say, I couldn't do what you do for 5 minutes, because they get so scared when they're taking care of a sick child. So yes, I think it's hard for me to look at what we do and say, oh, that is heroic, because it seems, I think, routine, I guess, and it's easier for me to look at others and see, of the challenges that they face, because it seems so out of the routine for us, and those people are my heroes.
I think it's really commendable on multiple fronts. One, the work that you do, right? It's nothing short of, I know we thank our army and our defense services for their service, but one thing that became evident in this pandemic is there are heroes out everywhere, and doctors for sure. So thank you for your service. And the other thing that's really commendable to me is the ability to, just what you said, that it seems routine. It is not, but I understand why you would say that, because you do it day in and out. And when you have to deal with a pandemic level of, I don't know what the right word is, but insanity, it just seems like you're just doing a little more. So, and then also, you thinking of others as the real heroes, it just shows the humility. And I think that just comes naturally to you, or has become your nature after having done the service and given back to the community as much as you have over the past several years. So thank you.
Thank you. That's very kind.
Let me switch gears and talk about the biggest opportunity you're targeting. We've, looks like we've come out on the other end of this, and what doesn't kill us makes us stronger. What are we looking at? What are you specifically looking at?
Well, there's a couple of things. I mentioned a little bit earlier how I think that oftentimes in medicine we tend to be, compared to other industries, I think, slower to innovate, and some of it has to do with obviously the challenges of medicine, whether they are scientific and technological challenges or medical legal challenges. But one of the things that we were able to accomplish extraordinarily fast that I'm very proud of was our ability to develop a telehealth program. Mm-hmm. And so, when those numbers dropped from 300 to 75 or to 100, all of us were looking around, particularly because I think that, again, because of how we sit and where we sit, both in LA and both in our society, we serve underserved patients, right? So patients who don't have adequate health care, right? Emergency medicine fills in those gaps. So if you don't, if you have a physician, a pediatrician that you can't reach when your child is sick, we're there for it. If they are only open the hours that you have to work, and you work in a job where you're going to get fired if you try and take your kid to the doctor, patients and families will often come to see us. If you are uninsured, if you're underinsured, if you're undocumented, we fill in a lot of gaps, I think, in our society. So all of us were wondering when this happened. We're like, well, what happened to our kids? And so, and obviously one of the things that happened was that people, were instructed to stay at home and were afraid to go out. And I think they were also afraid of catching COVID if they came to the emergency department. And that has been shown, in adults where people waited at home when they were having a heart attack and were and either had a bad outcome because they were scared to come in. And so what the hospital and our department were able to quickly do, again, a process that probably would have taken years, we did in about less than a month, is create a telehealth presence. And so a virtual urgent care. And so it kind of started small and has done a lot over the course of the last year to increase our footprint into accessibility for patients. Mm-hmm. So the virtual urgent care that we designed was, as opposed to a doctor's office where you call and try and make an appointment, things like that, we created an on-demand virtual urgent care. Mm-hmm. And then we integrated it into our physician workflow in the department. So we didn't add a staff person, we didn't add anything. We actually created a virtual patient room or a virtual patient list, and our docs, while they're seeing patients in real time, would also see virtual patients in their workflow. And obviously, they were used to seeing more patients, and so we had the ability to do that. Well, that, I think, what started out as a necessity to try and reach out and increase accessibility to patients, I think is going to become part of our new business model. Basically capitalizing on the expertise of our staff and reaching out to more patients. The interesting aspect of pediatric emergency medicine when you work at Children's Hospital Los Angeles, as opposed to some of the maybe more well-to-do hospitals and well-to-do areas, is that the docs that you're seeing are the most highly trained, most specialized, seeing those patients. So just in terms of, I'm speaking in gross generalities, but in terms of quality of training, quality of and depth of training that these docs have, in the case of pediatric emergency medicine, oftentimes the most underserved patients are being seen by the most highly trained, specialized patients, or specialized docs. I think this is an opportunity for even people who may go to, some more of their local, maybe more affluent hospitals, but are seeing less intensively trained personnel to actually access some of our experts.
That's very interesting. I don't know what kind of numbers are available to share, but I'd be curious to know, obviously this started off as a necessity and the numbers would be higher, but now that things have somewhat normalized, what percentage of your appointments are continuing to stay virtual?
Well, actually, the opposite has been true. We actually didn't start came down. We've actually been climbing month to month. Now, it's been around for less than a year. Well, it's coming up on a year. But this was again the mother of necessity. Mm-hmm. It was done without a marketing plan. It was done without a reach out to the community. Basically, what we did was our patients who came to the department initially, we would just hand them a flyer, or patients would call in saying, am I safe to come in? We're like, well, maybe you want to do a virtual urgent care visit. So now I think that we've realized the value of it, the fact that we're able to do it. We're actually going to be putting more effort into it. And the hope is to actually maybe grab 5 to 10% of our patients, 5 to 10,000 a year, and have those low acuity patients. So because the focus of that virtual urgent care is going to be things like rashes or simple illnesses, minor injuries that we may be able to do virtually. Nothing replaces
level 1 where you may not need to come in. You can see
correct.
It, you can just kind of analyze or consult.
Correct.
If there is a need for a follow-up, then you come in.
Right, and so that is part of how we do it. It's an integrated business. So if we do assess that the child needs to come in and be seen, either for testing or for a more thorough exam, their visit is kind of integrated into their emergency department visit.
And I'm sure it's also efficient, in terms of costs and operations to be able to the
It's
turnaround.
about as it's
Right.
about as lean as possible. So
Right.
it's literally just a registration person and a physician, and yeah, it has a great deal of potential. I think you're seeing more and more health systems that are expanding their telehealth capability, and there are certain specialties I think that may never go back to inpatient visits. Emergency medicine, it's a small chunk of emergency department patients, but I think there are plenty of specialties that are a large chunk of what they're going to do is going to be virtual, and it's going to cut down on all those different costs, whether it's opportunity costs from time and commute and parking, etc. So, and
Right.
office space.
Makes sense. And those little things add up, right? And I think the economic value of that coming back to serve the health of this community is just exponentially going to go up.
Right. No, I mean, I think the ultimate goal of getting more children to be able to see their doctor,
Right.
and meeting patients and families where they are, I think is going to be the ultimate value of this.
True. Was there a lesson learned, something as you were trying to figure out a lot of these things as a team, something that you may have come up with and didn't work as you expected? And you maybe either had to switch gears, pivot, or just kind of say, hey, we tried, but it didn't work.
In the During the COVID times,
Or in
uh,
general, if you have any other general example where what I'm trying to learn about is, oftentimes we pursue, we persist, and we see success, but sometimes we don't. And what we learn from it, what we take away from it, is as important, if not more important, than what we learn from our successes.
well, yeah, I will tell you I think thinking of it in terms of industry and process. What is unique? One of the things that I love about emergency medicine is that it is the type of medical practice that lends itself to data-driven process improvement.
Mm-hmm.
And we've tried. We built this new department that we had. Our new department we had built about, I want to say it was 9 years ago. It was designed to see about 65,000 patients a year. It was designed to grow into that 65,000. Well, as soon as we opened it, that first year, we were there and we're actually past it. And in the course of the next 4 years, we grew from about 65,000 to almost 85,000. And so we built this new place to handle all this new work, and we're busting at the seams on day one. And the natural, I think, inclination is to either throw people or throw people at the problem, like staff, or throw beds at the problem and try and increase your capacity. And that is historically how we would do things. We'd have a big surge in patients, and we'd hire a bunch of new docs and hire a bunch of nurses, and then try and do what we can with the physical space. Put chairs here, put chairs there, create but not necessarily looking at it in kind of a data-driven sense. And we would try a couple of things. We'd say, oh, let's create this rapid triage area to see patients very quickly. And we tried it. We tried probably 4 or 5 different things where we tried to add beds, where we tried to create innovative ways, but we never necessarily looked at the pre and post data, how it affected patients. And once I think we realized that almost every patient in an emergency department follows a very linear workflow, a very linear kind of path of travel where they see the triage nurse, and now with electronic medical record, everything is timestamped. So when you see the patient, it's timestamped. When you write the orders, it's timestamped. When the patient's given the medications, it's timestamped. There is an extraordinarily rich amount of data that is collected now in the electronic health record. So about 4 years ago, we were able to leverage some of those things, create kind of a workflow map that was driven by data, and we're able to take, kind of one of the key performance indicators for emergency medicine is what's called your left without being seen rate. So the two kind of rates that we look at are what's called the length of stay, how long a patient stays in the department from the door to when they leave, and then the number of patients who leave without being seen. So if it happens when you go to Costco, the line is too long to get in, you're like, forget it, I'm not going to Costco, I'll come back another day. It happens in emergency medicine where patients will register and they may have, not a horrible complaint, but they may have, it sounds like a hilarious thing that you have an emergency, but you're like, well, I'm not going to have my emergency today because the line is too long. Those are scary patients.
You read my face.
Those are frightening patients, I think, for us. You know what I mean? So any patient that leaves without being seen is a child who's potentially very sick, or a child who's potentially hurt. When they look at adults who leave without being seen, some of them have to go home and have their heart attacks at home or their strokes at home. And so a key indicator for a successful emergency department is keeping that left without being seen rate as low as possible. And you can tell, because of the breadth of things that we handle, sometimes patients wait a long time to see us, 3 and 4 and 5 hours. And so going back to, so what we're able to do is to take that data and create a process, a defined process, one that we're actually able to look and measure what we are doing and the success of what we are doing. And we put in a couple of different little process workflow changes in the year that and then did it all at the same time, created this new workflow in it, and used a data-driven way of looking at how we saw patients. And we were able to reduce our average length of stay for those 85,000 patients on average 1 hour. So 85,000 hours of time we were able to create. We dropped our left without being seen rate from about 6% to less than 1%.
Wow.
We didn't hire one person. We didn't add one bed. And we didn't hire one doc. We didn't hire one nurse. We didn't add one bed.
That's phenomenal.
It's and for an academic, so those are the type of things that happen in community hospitals, I think, regularly. In an academic institution where you have residents, where you have trainees, where many of us are all of us are faculty, so we have our clinical part of our job, a research part of our job. To make those changes in an academic institution was something huge for us.
That's congratulations. Those are huge numbers at that size and scale. Extracting that level of efficiency, that's mind-blowing. So, this, as you were talking through this, it reminded me of our previous conversation where we talked about, being intentional and focused on the work you do. And you had described to me the constant barrage of information that you have to deal with and how that transforms you to a point where you are still focused on what you're doing, but these additional inputs or streams of distractions, as I would call it just seems to be natural and you just kind of figure it out. So talk to us a little bit about, what that process looks like inside of not just any emergency room, which would be, maybe more intense than a pediatric emergency room, because like you said, you're also dealing with more than the technicalities, the emotions. So how does How do you even work in that space?
Yeah, it's one of those things where we I think we like to talk about focus in our work, right? Meaning limiting the number of distractions that you may have, right? Getting into I
Zone.
think you and I both, yeah, right, getting into the flow, or getting into the zone. And I think you and I both have kind of talked about some of the books that we've read.
Yes.
And one thing that had one of my favorite, one of the I love like drawing parallels from other industries, right? And one of my favorite books that I've read was a book called Kitchen Confidential by Anthony Bourdain,
Yes.
right? And he talks about what it's like to be a line cook,
Yes.
right? It does where he talks about, yes, you are focusing on creating that dish while you're cooking it, right? But part of the life of a chef is dealing with all the, particularly a line cook, is dealing with all the incoming fire, because part of your brain is listening to, the orders for what the next dish is going to be, getting the other dish prepared, being cognizant of the person that's working next to you. And, it is an environment where if you think about, focus on a single task as being, it makes for an unsuccessful chef, right? The nature of the work, the nature of that specific work is being able to deal with all that incoming fire. It's not being so focused on one thing that you're able to deal with all the other, that distraction is the point in emergency medicine.
Yes.
That if I'm not bothered, if I try and sit down and if I'm not bothered within 2 or 3 or 5 minutes of what I'm doing, I'm worried about that I'm missing something, right? And so I think it's just a different kind of understanding of what it means to be in the flow, that the job that we've chosen, that job within medicine we've chosen, actually where distraction is almost the point. Now, if you're a neurosurgeon, right, please don't distract me while I'm trying to take this piece of brain out of your brain without touching the other part of it, right? In that in that field, if you're a plastic surgeon or something like that, singular absolute focus and being able to drown out everything else that's going on around you is of vital importance. But emergency medicine, again, I think it's better that we take a broad view and that embrace a little bit of the distraction as part of what we do.
I find that fascinating, and I'm sure that's really helpful for someone who's even starting to think about what line do they want to specialize in. Right? It's a completely different mindset. I don't know how much of this is nurture versus nature, but it does take a different kind of fabric, right? To be not just okay with it, to excel in that kind of an environment.
Yeah, it is. I think an idea that I've been toying with, and again, I think I mentioned it to you. There's a lot of talk about the physician scientist, right. And we I think are trained from college to have a very science focused kind of education, a science focused, how we look at data, how we innovate, how we make medical improvements, all have a scientific foundation, whether it's hypothesis testing, evidence-based medicine, all those things. But I think that when you think about physicians and the practice of medicine, and some people use the term art of medicine. Yes. That's something I struggle with a little bit, and I think that the term that I prefer is artisan or artisan of medicine, and the point being that artisans are people who take scientific principles, right? Whether they're building buildings, or they are chefs that are cooking, or they are making bourbon. Artisans take specific principles, all based in science and math and a lot of data. But what sets an artisan apart is how they synthesize that and they bring it to you. Right. And so So when you go to a nice restaurant, right, that chef is using a variety of different principles to present to you that that food, and it's those little, that mastery of doing the same thing over again, understanding those principles, but then applying it in the right way. And I will tell you, you know, having been through both sides of the stethoscope with, you know, being a physician, and then being with my father when he got sick, and his interactions with the healthcare, with the healthcare system. The physicians who are artisans who knew how to reach my dad, right, had nothing to do with their knowledge of evidence or anything like that, but how to talk to him, how to help him understand his illness, how to help him understand the value of the medicines that he wanted to take, how to help him understand, you know, he was taking some strong medicines and had a lot of side effects. Well, the physician's ability to kind of create that therapeutic alliance with him made a difference in his life, right? Made a difference in the outcome that had nothing to do with the science of it. And so I like to, you know, the docs that I work with, and think of myself as not just physician scientists, but physician artisans, and understanding that those relationships that you have with patients have an effect on their outcome. You know what I mean? Not just the medicines that you write, but the way that you present it to them, the way that they understand it. All those things have a huge outcome on wellness, on healing.
That's beautifully said. Beautifully said. On that note, I want to switch gears, if you will, and focus a little more on you through some one-line life lessons. So please share a few with us.
Sure. And thank you for asking me to look these up beforehand, because I hadn't thought about them. And this is really, it was kind of a fun exercise. And so one I pulled, I mean, I mentioned Bourdain, and, you know, being someone in my position who now, you know, help build our staff and hires people, who gets to train young physicians, whether they're residents or fellows. You know, my favorite quote from Anthony Bourdain was that skills can be taught, character you have or you don't. And so true, I think, for physicians, for people in healthcare provider, is who they are matters so much more, that their character matters more than, and that is what I think we should hire for, that we should train for, that we hire, and we aim to choose people who have that high character, and then learn and understand that the skills that are required can be taught.
Right.
Again, along that same lines, I will quote myself, and particularly after this one past year, is one liner that I had talked to my children about while we were going through. You know, because I think being the child of a dad who works in the emergency department can be rough sometimes, both scary for the kids, and then tough when I get home and yell at them because somebody else didn't wear their helmet. But what I talk to my children about is that crisis doesn't build character, that it reveals it. Is that who they are during the hard times, you know, or during the hard times, it reveals who they are. And you know, I'm fortunate because, you know, during this crisis, I witnessed just, you know, between my amazing wife and my 3 children, you know, what type of character they have, that they developed, because it's been such a hard thing for everyone, and being able to watch them deal with things and do their best during this time, I think, has been amazing. And so
that's really beautiful. I have no words to express it. It touched a nerve. Beautiful. Thank you for sharing that.
Of course. You want more?
As many as
let's see if I have one more that will be this. Well, this is again, is I think one that related to children. You know, between being a pediatrician and then being a dad, I tend to focus a lot on children, for sure. And then James Baldwin said that children have never been very good at listening to their elders, but they have never failed to imitate them.
I love that, and it's so true.
Yeah, it's something that had totally had just kind of uh, uh, rung true with me. My sister, and I think you and I had talked about it as well, is that I'm always surprised, I think, as to how different my three children are. Everyone is very surprised as to how my wonderful, amazing type A superhero sister is, and wonder, how they come from the same parents. And it's because, they don't listen. We didn't listen to our parents. We became our parents.
That is funny, but so true.
Yeah.
Okay.
All right.
Keep them coming.
All right. Here's the last one. Okay. I'll tell it to you from my friend Anthony Bourdain. Right. Is that I do not have to agree with you to like you or respect you. And again, I think that these days it's of such importance, I think, to understand that the diversity of thought and opinion, and the diversity of ideas. I think that we have friends from the whole spectrum of life, from the whole spectrum of everything else, and I think that it's boring to only have people that you agree with.
Yes.
And it's so important, I think, to understand that I love discourse. I love trying to delve into complexity, and that doesn't happen when people are all thinking the same thing. And I mean, the people who I hold dearest to me, I think oftentimes I don't agree with very much on at all. But but that's the fact that they are. Yeah, I think that's what makes it fun and interesting, for sure.
I think you're right. The people that challenge us are the ones that help us grow.
Yeah, that's exactly right. I agree 100%.
Ameer, this has been an absolute pleasure. Thank you once again for your service and for taking the time to be with us today. We would love to continue this conversation, and looking forward to meeting you in person pretty soon.
I can't wait and this was so much fun. Thank you.